Today, we're going to talk about how to avoid getting surprise medical bills. Let's face it, nobody wants to get that envelope in the mail and open it and see this surprise medical bill where the number is so much bigger than what we expected, right? Not fun at all. So in this video, we're going to talk about a few tips on how you can avoid getting any big surprises when it comes to medical bills. There's so much confusion around in the healthcare industry around what medical procedures and treatments actually cost. And the thing that makes it a little bit more difficult is that the variation between costs of the same medical procedure, it varies so greatly between providers, and especially if you're talking about, rural areas compared to bigger cities. And so one of the things that you can do to really avoid being surprised when you get your medical bill is be a little bit more proactive as far as asking for cost estimates. You can always ask for cost estimates, and this is something that also you would do if you were planning a procedure like a surgery or something that you could plan. Not all medical treatments we're gonna be able to plan, right? Like sometimes there's emergencies and we gotta just go get the treatment and then deal with the bills later. But this is really tailored to like when you can plan it, like a surgery that you need coming up. You can use some tools to help foresee the cost of that and maybe get a second opinion if you need to. And so one of the things that you can do is call the provider and ask them, depending on whatever your insurance is, you call the provider and say, okay, with my insurance, what is going to be my out-of-pocket costs? Now, if you don't have insurance, you want to ask what is the cash pay or the self-pay rate, and they should be able to give you a flat fee for what it costs. You want to make sure to also add, and this is especially the case if you're doing a surgical procedure, there are other costs associated with it. So if there's anesthesia, there might be a separate charge for the anesthesia. Also, if you're having it in an outpatient, like let's say surgical center, there might be a cost associated with just the surgical center. So you want to make sure that you find out what those individual costs are. And if you have the insurance, you can also ask them, what is your estimated out of pocket given the plan that you have? Another tool that I love and I share with all my clients is called Healthcare Blue Book. Healthcare Blue Book is a site and it's free to use, and you can go in there and put your zip code and the treatment that you need. Let's say we're talking about that surgical procedure that you need. You can put in the name. It's extremely specific, so you can get specific details. And what it'll give you is it'll give you the fair prices and also a range of prices for that particular procedure in your area, so that you know that the price that you're quoted is fair or is it not fair. And if it's not fair, if it's something that's a little bit too high, you may want to go get a second opinion. Generally speaking, a couple of other tips that I've learned in my years of doing this is if you're going to do things like, let's say, a colonoscopy, you want to find a place that all they do is colonoscopies. They specialize in colonoscopies. And so there's centers that just do that. And there's centers that just do, let's say, mammograms for women. That's something that women have to do every single year once they get to a certain point in their 30s. And so these kinds of large centers that focus on one specific area tend to be a little bit cheaper, whether you're self-paying or whether you have insurance. And lastly, if you have an insurance plan, the best way that you can avoid being surprised is work with your agent or call the insurance company directly to see what is your estimated cost. You need to know your deductibles, know your coinsurance, know your out-of-pocket, know if outpatient is treated differently than inpatient. That way you can know what your coverage is and kind of estimate how it's going to be allocated. An important part of that is if you have a PPO, like I do, there's the contracted rate or the PPO discount that you will get on certain covered medical procedures. So you want to know what that contracted rate is. And sometimes you're able to get that from the insurance company or the provider. I hope these tips I shared with you today will help you try to prevent some unexpected surprises. I love surprises, but not these kinds, and I've had them in my life, trust me. So I love working with clients to really help them be more empowered around their health, whether it's using their health insurance or finding the right plan. You can reach out to me at alexthehealthagent.com. I would love to help you. And also make sure to follow my Instagram because I have a ton of great videos that are fun, and I try to break down complex concepts about health insurance into easy to swallow little videos that are fun and easy to understand. And if you liked this particular video or you know somebody that would benefit from it, please share it and also like, comment, and subscribe.